The purpose of this video is to educate on proper diabetic foot care. This should not replace medical guidance provided by your physician.
I'm here today for my lab results. I've been peeing a lot lately. I've been hungry a lot more, and for some reason I'm so thirsty, and I just don't know what's going on in me.
Well, I'm really glad you came up for your follow-up appointment, Mrs. Rose. I need to speak with you about your lab results. From these results, it's apparent that you have diabetes.
What is diabetes?
Well, diabetes mellitus is a condition where you have too much glucose or sugar in your blood. Glucose is what's used by your cells in your body for energy, but we need insulin produced by your pancreas to break down the glucose so your cells can access it and use it for energy. In diabetes, the glucose remains in your bloodstream, and therefore your cells cannot get the energy they need. There are two types of diabetes. Type 1 is when your pancreas doesn't produce enough insulin. The second type is where your cells are insulin resistant. That means the cells don't respond correctly to insulin, and the glucose is never transferred to them for energy.
Is this a lifelong thing?
Well, unfortunately for you, you do have type 1 diabetes, which means your pancreas just isn't producing enough insulin. So it will be a chronic or lifelong condition. However, that doesn't mean that it cannot be very adequately managed with medication and proper diet and nutrition.
I know that too much glucose is bad for me, but how does it affect me?
Well, diabetes can affect you in many ways. One of the complications of diabetes that we worry about with patients, especially elderly patients, is diabetic neuropathy, which is nerve damage that can be caused by having too much glucose in your system.
How do I know if I have too much glucose?
Well, you will feel symptoms that indicate that your glucose is high. Some of the symptoms you might experience are increased thirst, like you've been experiencing recently, and frequent urination. You can use a blood glucose meter to measure your glucose levels, and this way you can check your blood sugar in your body multiple times a day. You should take your blood sugar before you have breakfast or after 6 to 8 hours from your last meal. You should always be within the range of 70 to 110 after your meal has been digested.
Okay. What does this mean for me?
Well, one of the most commonly seen effects in patients with diabetes is complications with your feet. As I mentioned, the sensory nerve damage. Since you have these damaged sensory nerves, you're more susceptible to trauma to your feet, ulcerations, infections, and the like. Sometimes you won't even know it until you check it out yourself. That's the real danger with it. There's also a decrease in blood flow to your lower legs, since it damages those blood vessels too. With this being said, your tissues don't get enough oxygen, white blood cells, and nutrients, so it can't heal the wounds that you may have at a normal rate. You can even develop a foot deformity called neuropathy, arthropathy, or charcot foot, which is an abnormal weight distribution on your feet that gives you new pressure points, increasing your chances of having these ulcerations in your feet. Since they secrete less sweat, you also have dryness and cracking of the skin of your feet. And once you have nerve damage, decreased blood flow, and sepsis, which is a complication you can have from infection, you're prone to getting gangrene and even needing amputations.
Amputations?
Yes, amputations. That's why it's extremely important to take care of your feet.
What do you recommend I do?
Well, I can have a nurse come to your house and demonstrate it for you. I'll also give you a pamphlet of foot care techniques to take home with you and more information about checking your blood sugar.
Okay, perfect.
Great. So I'll see you back for a follow-up appointment, and I'll see how you're doing.
Okay, perfect. I'll see you soon.
Okay.
Hi, Rachel. How are you?
I'm good.
Okay. I'm from the agency.
Okay.
I'm here to teach you about diabetic foot care.
Oh, good. You can have a seat right there, and I guess you can get started there.
Examine your feet daily for cuts, sores, blisters, swelling, red spots, or infected toenails. Use a mirror for assistance, especially for the bottom of your feet. Monitor for signs of infection. Do not depend on feelings of pain or sores since your sensory nerves are impaired. If you have poor vision, it's better to ask others for help in inspection.
Clean your cuts with warm water and mild soap. Cover with a clean dressing. Do not use iodine, rubbing alcohol, or strong adhesives. If cuts don't heal within 24 hours, contact your doctor, especially if you see signs of infection. If you get corns or calluses, contact your doctor. Corns and calluses are hardened areas of your feet that form from skin rubbing against bony areas. Do not remedy these on your own.
Wash your feet daily with a mild soap and warm water. Make sure you test the temperature of the water with a thermometer or your hands. The temperature should be 90 to 95 degrees Fahrenheit or 32 to 35 degrees Celsius. Try not to soak your feet since this can easily cause drying and cracking, which will lead to infection. Pat your feet dry gently, especially between toes. Do not use a rubbing motion. You can use talcum powder or cornstarch to help dry your skin between your toes. Use lotion or lanolin on the top and bottom of your feet to prevent skin from drying and cracking. Do not use this between your toes since it will make it too moist. Use mild foot powder on sweaty feet. Cut your toenails straight across weekly. You can smooth sharp edges with a nail file. Cut toenails even with rounded contour of toes. However, do not cut down corners. The best time to trim nails is after a shower or a bath. If you want to cut your toenails, separate them with cotton or lamb's wool to keep them from overlapping and accidentally cutting the wrong area. If they become yellow, thick, or grow downward and curved into the skin, contact your doctor. The latter is an ingrown toenail that can easily cause infection. Do not walk around barefoot. Always wear something for protection. Make sure you pick a shoe that fits well and has good support. Make sure your shoes don't fit too tight or it can cause an ingrown toenail. It's recommended that you do not use sandals, high heels, pointed toes, open toes, and plastic shoes. Leather is the recommended shoe material for use. If you wear slippers, make sure they have soles. Before you put them on, make sure there isn't anything inside that can cause harm to your feet, such as pebbles, worn areas, and rough spots. It's also better to shake them out a little first for safety measures. Always wear socks. Make sure to wear clean, absorbent socks, such as wool or cotton. It's better if they are seamless or do not have mended areas. Colored socks must be color fast. If you want to keep your feet warm, wear socks. Do not use heating pads or hot water bottles. During the cold, check your feet for frostbite. Make sure to exercise your feet daily. You can do this by walking or simply flexing or extending your feet. Do not sit, stand, or cross your legs for a long period of time.